Hello everyone, welcome to GrowMed. This channel is a one-stop guide for the Fmge aspirants where we will be discussing about the important topics, important points, images and all you must know to crack the Fmge exam. So join with me to ace this exam. Subscribe to GrowMed and tap the bell icon so that you do not miss any important study tip. So I had started a series of the must-do topic from all the subjects, but due to some reasons I couldn't complete it. I couldn't post the videos of all the subject. So the remaining subjects which I couldn't post, now I will be posting all the videos of the must-do topic from every subject. So do watch all those videos to make your study more effective and easy. So let's start from the pediatrics. The must-do topics which you must do. First and the important is the neonatology. So the questions asked from the neonatology are on the neonatal resuscitation, neonatal meningitis, neonatal sepsis. So the questions on the resuscitation are asked on the steps. Like how will you resuscitate the patient, or when will you start giving the when will you start giving the positive pressure ventilation? That is when the heart rate will become less than 60. Okay. And how much oxygen you will use? That is 21% oxygen. Then the room temperature, it should be approximately 25 degrees Celsius, and the order is the mouth followed by the nose. So questions are also asked on how do we do or by using which equipment you will be doing the resuscitation, and it is the self-inflating bag and mask. And another very important question is that this bag and mask is contraindicated in congenital diaphragmatic hernia. Then on the sepsis, the questions are asked on the causative organisms and the clinical features, or a case like of a question can be given where they will be describing the feature of the sepsis and you need to make the diagnosis. And same for the meningitis, either a clinical case can be given describing the features of the meningitis like fever, irritable seizures, and the CSF findings can be given. And by using all those following things, you need to look which of the following can be the cause or which type of meningitis it can be. So questions are also asked on the types like the bacterial, then the TB, fungal, or the viral. So another important topic from the neonatology is the FCAR score. So FCAR, the table, you need to remember all the points, actually by heart the whole table along with the features and the score, and which is the maximum, which is the minimum. So all these things related to the FCAR score you need to by heart it. So questions also are asked repeatedly on neonatal jaundice. So the classification of the neonatal jaundice, that is the physiological, pathological, breastfeeding and breast milk, and the treatment. How do we treat it? One is the phototherapy and another one is the exchange transfusion. Okay, so all these points you need to know from the neonatal jaundice. And also the percentage, how much percentage or how much gram per dl is involved when there is yellowing of the face, yellowing of the legs, hands, palms, soles, stick. So there is different scores for this, and you need to by heart all those scores as well. Then moving on to the next important topic, that is the developmental milestones. So questions are repeatedly asked on this, and you can expect one question in all the exam on the developmental milestones. Okay, so the developmental milestones, these are the motor, then the social, then the language. Okay, so you need to know in which month which milestone will be developed. Like in the motor, sitting with support, and it is the 5 months, and sitting without support it will be the 6 month. Then the grasp, the ulnar grasp, the hand regard, head control, that comes at the 3 months. Then drawing a circle, which comes at the 3 years, drawing a square, a triangle. So which milestone develops at which year, that all you must know. And if this does not develop by that age, then there are some red flags as well which you must know. Then likewise for the social also it is the same, like the social smile, when will the child recognize their mother, then waving of the bye-bye. So all these things develop at which age you must know. Then the language, like the monosyllables, the bisyllables, saying a single word, that like ma, then pa, then papa, then baba. Okay. So if an easy one-liner is asked, then you can easily solve this question, but one-liners are not asked on this topic. Usually a big 4 or 5 lines case kind of a question is given, like the child is now, for example, the child is 6 months. So at 6 months what all the child can do, those will be described in the question, and you will be asked that what is the age of the child. Okay, so you need to look at the features that are described in the feature and look at the options and choose the correct one. Then next, also malnutrition, another very important topic. In every year a question is asked, so you can expect a question in this July exam also, June exam also. So questions are asked on the malnutrition, acute and the chronic, and the parameters which are used to identify it. Like for the acute, it is the weight for the height and it is called as the wasting, and for chronic it is height for the age, which is called as stunting. So there is another criteria for the severe acute malnutrition, and that is if weight for height is less than -3 z-score or less than -70. Weight for height should be less than -3 z-score. Okay. Then if the mid-arm circumference it is less than 11.5, and if there is symmetric bipedal edema, then it is called as severe acute malnutrition. So in this severe acute malnutrition, there can be other complications also present, like hypoglycemia, then hypothermia, infections, electrolyte imbalance, dehydration, then deficiency of the vitamins, micronutrient. Okay, so what you need to do in the severe acute malnutrition is to look at the case first and to look at the complications, and looking at the complication you will be treating accordingly. Like if there is hypoglycemia, then you will be giving the glucose, then if it is infection, then the antibiotics, and dehydration, then the saline or the rehydration. Okay, so likewise you will be treating the patient. So another very important topics related to the malnutrition is the kwashiorkor and the marasmus. So the image based question are asked frequently in the exam. So you need to know the differentiating features between the kwashiorkor and the marasmus. In the kwashiorkor, there will be protein deficiency exclusively due to the deficiency of the protein, and the classical finding seen with this is the edema. Okay, so the patient will having edema, but whereas in marasmus the patient will be thin. Then speaking about the another differentiating factor, that is the appetite. In kwashiorkor the appetite will be poor, and in the marasmus it will be voracious, means the appetite is good. Then the kwashiorkor baby, he will be having apathy and lethargic. That means he will be weak and not interested to do any things, and along with that there will be hepatosplenomegaly seen in kwashiorkor. And the marasmus, it is mostly due to the calorie deficiency, and the patient will be looking like monkey faces and having baggy pants because there will be loss of fat from the body. So it will be extremely thin patient, and the bones can be visible that thin. Okay, so the images also are important, so look at the images also. Then the next topic, developmental parameters, like the height, the weight, the mid-arm circumference, then skin fold thickness. So all these things you need to look at. Like the famous question asked is height doubles by itself at, so it doubles by itself in the 5th month and triples by itself in the 1 year. Likewise, the same is for the weight. When does it double and when does it triple? And how do we measure the height? For the infants, it is by the infantometer, and for the children who are more than 2 years age, it will be the stadiometer. Okay, so questions are also asked on the disorders related to the height, that is the short stature, the types of the short stature. So the two most important which you must know is the familial type and the constitutional delay in growth and puberty. So repeatedly clinical case based questions are asked on this. So look at the features and the causes. And the other parameters like the mid-arm circumference, there are also certain values like the normal, then malnutrition, suggesting the malnutrition that is less than 11.5. That is based on this tape, that is the Shakir tape, it is classified into the red, the green and the yellow. Then the skin fold thickness, we will be calculating it using a hairpin caliper. So a image based question was asked on this hairpin caliper. This image was given and the question was asked that this instrument is used to calculate which of the following. So these were some important developmental parameters which you must learn. Then moving on to the breast milk. So questions are asked on the content of the breast milk. That is, which carb does it contain, the carbohydrate, how much quantity does it contain, then the protein, which protein it contains and in how much quantity, the fats, the minerals, the vitamins. Okay, so all these questions are asked related to the breast milk, and also its storage. How do you store the breast milk? Like in room temperature, it will be 8 to 10 hours in the room temperature, but in the refrigerator you can store it up to 24 hours. And this refrigerator one, this was asked many times. And also repeatedly questions are asked on the vitamins deficient in the breast milk, that is the K, then the D and then the B12. So K, if K is given in the option, then you must select the K, and if not, then the D. And along with that, you also need to look at the other parameters, other features if they are described in the question. Then moving on to the puberty stages. So stages of the puberty, this is also a must do topic, and every year one question is asked on this puberty. So So you need to look at the stages and the signs. So the stages are the thallark, pubark, growth spurt, and the menarche. So these are different for girls and different for boys. So you need to remember the sequence of this. And the signs, like for the girls the first specific sign is the thallark, and for the boys the first specific sign is the testis enlargement. And how do we assess the testis size? We will be doing it by using the orchidometer. So a image based question can be asked on this. So look at the image of the orchidometer. And the staging of the puberty, it is done by the Tanner stages. So this Tanner stages is classified into the stage 1, 2, 3, 4 and 5, and you need to look at the first stage में कौन से finding दिखती है, 2 में कौन से finding दिखती है. Okay. Alright guys, then moving on to the next. तो ये हो गई थोड़े से जो general pediatrics से related है. Then looking at some systemic disorders. So this video is gonna be a little lengthy, so watch the video till the end so that you do not miss any important points. So looking at the next important certain systemic disorders, so from the GIT it is the esophageal atresia, and the questions are asked on its type. So esophageal atresia means there will be a blind pouch. The esophagus is not connecting to the stomach, and there are 5 types. So look at those types, and the most common is the type 3. So in some conditions there will be also tracheoesophageal fistula as well. So the clinical features you need to look at this, which can be described in the case like excessive throatiness from the mouth, then difficulty in feeding, and history of polyhydramnios. So if these 3 findings are given in the question, then mark the answer as the esophageal atresia. Then the investigation of choice is the CT scan, and the first investigation which you must do is the passage of the NG tube. So the NG tube will be coiling in the chest. So by looking at this, you can assume that the patient is having esophageal atresia. Then questions are also asked on the diarrhea. So the diarrhea most common cause is the rotavirus in the pediatric, and how do we treat it? So we will be usually using the fluids, and the fluid of choice is the ringer lactate with 5% dextrose. So repeatedly question is asked on this 5% dextrose. So another very important point is the ORS. Okay, so whenever a pediatric patient is there, then we will be providing the patient with the ORS. Okay, so you need to know the components of the ORS and the osmolality content, the electrolytes and their amount in millimole per liter. Okay, so these all things you need to know from the dehydration. Then the neonatal reflexes, another very important question, and you can expect a one question from this also. The neonatal reflexes, they can be present. Some are present at birth and some appear after the birth. Okay, so you need to remember which are present at the birth and which comes after the birth, and also along with that you need to know the month at which it appears. Like for example, the palmar reflex, it is a very important question. So this is repeated many times and also asked in the June 2021. So this is the first to appear, and it appears in the 28th week of intrauterine life. So along with that you also need to remember when does it disappear. So this disappear at the 3 months of life. So look at the week and the month. So week means it is intrauterine life and months means it is after the birth. Okay, and from palmar also it is the ulnar, which is the first. So this question, I think this was asked recently in the Jan 24, not sure, but something like this on the reflexes was asked in the recent exam. So the other reflexes are the rooting reflex, which appears at the 32 week, then the Morose reflex and the ATNR, asymmetric tonic neck reflexes. So these all are present at birth. Now the two which appear after birth, they are the asymmetric tonic neck reflex and the parachute. So a question was asked on this parachute, that this reflex stays till which month of life. So this stays for lifelong. This do not disappear, so it stays for lifelong. Then moving on, the croup. So it is also called as acute laryngotracheial bronchitis. So questions are asked on the causative organism, which is the para-influenza, and questions are asked on the treatment. How do you treat the patient? So we will be treating the patient symptomatically by using the steroids, humidified O2 and nebulized racemic epinephrine. So image based question can be asked giving an x-ray and ask you to make the diagnosis, or can be asked how do you treat the patient. So the pattern of the question may vary, so you need to know all the points regarding the topic, because the question can be asked in any format, like image based question can be asked, clinical case can be asked, one liner can be asked, or all except kind of question. So you need to prepare in a way that any question comes from a topic, you should be easily able to solve it, and this develops by practicing MCQs. So solve as much as MCQs you can. There are a lot of sources for the MCQs, so you can solve the MCQs and keep on practicing them and look at your mistakes and try not to repeat them. Then moving on, congenital heart diseases. So this is also a must-do topic. And the congenital heart diseases, a question was asked on the NADA's criteria. Okay, so this criteria is classified into the major and the minor criteria. So you need to look at which features belong to minor and which features belong to the major. Okay. Then in this, the questions are asked on the congenital heart diseases are the tetralogy of the folate, then transposition of great arteries. So usually question are asked giving an X-ray, image-based question giving an X-ray and ask you to make the diagnosis. Then the next important question, laryngomalacia, which is important from the ENT point of view also. So this question also must do, and every year a question is asked. So laryngomalacia, this is omega-shaped glottis and it is a congenital condition. So there will be stridor present and the treatment is symptomatic. Okay, so by 2 years or more than 2 years, when the child will grow, this will regress by itself. But if it is not, and if the child is not able to breathe then and having difficulties, then we will be doing a management that is symptomatic, that is oropharyngeal airway. Okay, so image can also be asked on this image based question giving a larynx, and you can easily appreciate it looks like omega shape. Then moving on to bronchiolitis, question are asked on its cause. Okay, so the cause is the respiratory syncytial virus and the treatment is the ribavirin. So only these two questions are asked on this bronchiolitis. So these two, if you remember, then it's enough. Then moving on to another very important topic, pneumonia. So one question you can expect from this, and this question was asked in the recent Jan 24 also. Okay. So the pneumonia question, it is usually asked based on the IMNCI classification. That is, in this classification, it is categorized into the pink, the yellow and the green. So based on the clinical features, you need to classify into these categories and accordingly you need to treat. So if it is pink, then it is an emergency and you need to refer to the hospital, and if it is yellow, then you can treat it by giving the IV antibiotics, and if it is green, then you need to only take the antibiotics and the treatment can be done in the home itself. Okay, so ये topic करके जाना, it is a must do topic, and if you do it properly, then एक question pediatric से पक्का आपका हो जाएगा. Then moving on to another very important question, that is the hyaline membrane disease. So this hyaline membrane disease, it is usually due to the defect in the surfactant. So you need to look at the points regarding the surfactant. Its component, that it contains DPPC, then when does it begin to form, when does it appear, and after more than 35 weeks it is mature. And the X-ray finding which you can see in this hyaline membrane disease is there will be ground glass haziness, air bronchogram can be seen. And how do you avoid it? We can avoid it by using the antenatal steroids, that is the betamethasone and the dexamethasone. So you need to also remember the dosage, that is for the beta it is 12 mg 2 dose into 24 hours, and for dexa it is 6 mg 4 dose into 12 hours. Then another very two important topic, the cephalhematoma and the caput succedaneum. So the cephalhematoma, as you can say the name itself, that hematoma means there will be bleeding present. So there is hemorrhage, and questions are asked when does it appear. So there will be swelling in the brain. So both of these conditions present as a swelling in the brain, but the only difference is that the hematoma, it is the hemorrhage, and the caput succedaneum means it is the edema. And the caput succedaneum, it is usually present at birth and it disappears within 20 to 72 hours. Okay, but the hematoma, it is not present at birth and it takes time to disappear, like approximately 5 to 7 weeks. Another differentiating feature is that this caput succedaneum, it crosses the suture line, but the cephalhematoma do not cross the suture line. But the hematoma, it is dangerous as it can cause jaundice in the baby. So this was a list of the must-do topic from the pediatric. So there are other important topics also, like the glycogen storage disease, mucopolysaccharidosis, then the genetic disorders like the Down syndrome, the Turner syndrome. So these all things, they are covered in the biochemistry and the pathology. Okay, so the systemic disorders, if you do it integrated with the medicine, the surgery, the biochemistry and pathology, then you can easily solve the systemic disorders also, questions related to the systemic disorders also, because there are various pediatric conditions, congenital conditions like the horseshoe kidney, then the post streptococcal glomerulonephritis, the minimal change disease. So all these things, they are covered in the medicine and the surgery, so it's better you complete these topics from them. So that's it in this video, guys. I hope this video will be useful to you and it will help you guys in your preparation. I have already uploaded a video on the one-line questions which are asked from the pediatric in the Fmge, so watch that video as well. Thank you so much, guys. Bye bye.